Hi everyone, this is Dr. Karamanchi, go by Dr. K. Welcome to my presentation today. I wish everyone a happy Labor Day. I believe it's vacation time for everybody across the states. Here in Florida, people are freaking out about the hurricane. So I'll briefly talk about the hurricane and then I'll go over the presentation. Today my topic is polypharmacy and what we offer to our clients to get over that problem. So there is a lot of fear psychosis when it has to deal with hurricanes and natural disasters, and the reason with that is there's mass hysteria. Everyone is concerned about losing their property or losing their valuables, and it causes anxiety and stress, and then it snowballs into something big, which is happening in Florida. So I personally tell my close friends and clients to not look at news all the time, because the news is actually increasing their anxiety rather than helping them. You can get information online, or you can get information through other sources where you can quickly look at some type of an advisory for 1 or 2 minutes and know what's happening. So that's briefly about the hurricane. I'm concerned, but I'm not too concerned, and it's not occupying my mind. I want what's best for everybody. So let's talk about the present topic. So polypharmacy is very common, and I was familiar with the issue, but I never studied it in detail until I spent 1 year in geriatrics fellowship, where we looked at purely polypharmacy as a problem and how to address, especially in our older clientele, people who are 65 and above. So I worked with clinical pharmacists one-on-one with looking at and reviewing medications. The older clientele are usually on more than 10 medications. That requires more than a doctor. You have to work with a pharmacist to be able to look at all the drug interactions and see if you can cut down the dosage and so forth. So I spent 1 whole year doing that. I believe I have a lot of knowledge in that particular area. Even though it's in geriatrics, I believe some of those concepts can be applied to regular adults. So let me get started on my practice. I was trained in Western medicine, and I continue to practice here in Florida, in Apollo Beach, in St. Joseph South Hospital. I also have a clinic where I try to combine Eastern and Western modalities. I believe that using some of the treatment concepts in Eastern medicine help in either reducing medications or try to come off of some of the medications that we prescribe for our clients. So polypharmacy is a major public health concern. Medications are helpful, but they all cause side effects, and it is important to be aware of side effects. A lot of times what happens is physicians don't have time, or they themselves may not be aware, so they usually don't educate the clients about side effects for the medications. So then the ball goes into the court of the pharmacist. And in an outpatient setting, the pharmacist again is also dealing with a lot of clients. They may or may not have time to go with the medication paperwork, and a lot of clients don't even read the paperwork that comes with the medication or the prescription bottle. So a classical example is somebody who's on a statin for high cholesterol. This is the most common prescribed medication in the United States, and a lot of people don't know that statin can cause diabetes. They don't know they have to look for signs for high blood glucose. Like classical signs for high blood glucose are they're having to go to the bathroom more frequently, they're urinating more often, they are more hungry, they're having to wake up at nighttime to go to the bathroom to urinate. So these are some of the classical signs of diabetes. So unless the client knows what to look for, sometimes it may be 3 months or 4 months or 5 months, and then on routine testing the doctor will find out that they now have diabetes. But they never made the connection between the two, and the diabetes is now becoming a new diagnosis, and they get put on new medication like metformin and so forth. So this is how one problem leads to another problem, and that leads to another problem, and so forth. So I'll go over some of those, and also at the end of this lecture, I'm going to talk about some strategies that you can start using tonight or soon in your own life. So I want to briefly start about anabolic steroid use. So anabolic steroid use is unfortunately becoming very common, especially in high school kids. Everybody wants to look good, and they want to bulk up, they want to increase their muscle strength, they want to have a good physique, they want to be successful in sports, but they want to do it in a shortcut manner. So a lot of kids are resorting to anabolic steroids, and the problem with that is it can cause acne, it can cause the testes to become smaller. It can also cause their breasts to become enlarged, because when you use a lot of testosterone from outside, once it goes into the body notices that this is something that it doesn't need, and it converts into estradiol, or a component of estrogen. And once you have more estrogen in the body, it can cause your testes to become small, it can cause you to have what are known as man boobs in common parlance, and so forth. And eventually, if the kid is continuing to use these over time, it can cause them to have low sperm count, and it can also lead to infertility. And unfortunately, some of these become permanent, and they cannot be reversed if the doctor finds out at a later time. And if we are suspecting something like this, we get a complete blood count, we look for hemoglobin and so forth. We also test their gonadal hormones like LH, SHBG, and we also look at total testosterone level. So, and this is becoming a headache, because a lot of clients don't even tell us that they are using this. So you have to have an astute physician who understands this problem and who knows the markers for this. So I'm going to jump to dermatology. In dermatology, as you noticed, if you go to the dermatologist, the most often prescribed medication is the topical steroid. It's like the hydrocortisone or the one of the cortisones. So it's a really good medication if you have a rash or inflammation on the skin somewhere in the body. It relieves it right away. You notice improvement immediately. You notice you have less itching, you have less pain, and so forth. And it sometimes is the gold standard treatment. So, but the problem is it can cause thinning of the skin, and it can also cause what are known as striae. Sometimes there are lines on the skin if you use it on a long-term basis. And there is absorption into the body, although the classical textbook says that it doesn't cause problems with the adrenal gland. In the long term, it can cause some suppression of the internal cortisol secretion or the adrenal function. These days they're using what is known as tacrolimus, which is a immune suppressant, and it comes in a cream. There's another brand name or generic name called pimecrolimus. And sometimes these medications can cause lymphoma, or a type of a lymphatic cancer in the skin. So that's something to be aware of. And again, as I said, I'm going to go over some of the strategies to either cut down the dose of these medications if you're on them, or to try to come off at the end of the lecture. I want to briefly jump over to oncology. Oncology is becoming very common. I have talked to multiple family members, and I see in multiple clients, even younger ones, that cancer is becoming very common. Like if you look at 30 years ago or 20 years ago, cancer was more common in older people or middle-aged adults. Lately, we're noticing more cancer in younger adults, like people in their 30s, 20s, and unfortunately even in kids, especially blood cancer, leukemia, lymphoma, and so forth. Obviously, there are new treatments coming in. There is stem cell transplantation, there is biological treatments, there is what is known as immune-mediated treatment. And if you live here in Tampa area, the famous institution that people go to is Moffitt. I'm not affiliated with them, but they offer a lot of these treatments, and they also offer trials where you can sign up for one of their experimental trials and get an experimental medication. The problem comes in stage 3 and stage 4 cancer. So stage 1 is cancer is localized to that particular organ. Like if you have a cancer in the bone, the cancer is still there within the bone. It hasn't spread to the skin or surrounding arm or anywhere. I'm oversimplifying. So stage 1 is pretty easy to treat. Most of the time the doctor will do surgery to remove the cancer and maybe offer chemotherapy and radiation to prevent the spread of the remaining cancer cells. The problem comes with stage 3 and stage 4. You have a difficult choice where you can sign up for the chemotherapy, radiation, and so forth, and take a chance and see if that works or not, and go with the side effects, or take a risk by hi Hannah, thanks for joining, or take a risk by not taking the conventional treatment and just let the nature take its course. And that's where difficult choices are expected from the client. So there are a lot of misconceptions among my clients. One of my clients one day told me that she does not like this particular doctor XYZ because he or she is not pushing treatments, and this particular doctor is essentially giving up. And this is a negative notion that some of the clients have. They feel that if the oncologist, who's the prescribing doctor for chemotherapy, is not giving them chemotherapy, they are giving up on them, which may or may not be true. And they go to this particular other doctor to get a second opinion, and they feel happy when this particular other doctor gives them chemotherapy or radiation treatment, even though the doctor knows that it may not benefit and it may even cause harm to the client, where instead of dying in 6 months, they're going to die in 2 months because of the side effects. But some clients like this particular doctor because this particular doctor is very aggressive. They use this word aggressive. I don't know if that's a good terminology, but they feel that this particular doctor is aggressive, and that's why everybody goes to this doctor. And unfortunately, if you look at it from the system perspective, what it does is it causes overprescribing, and the doctors are also competing for clients. So, it leads to poor choices. So we have a lot of other holistic treatments that we offer, and I'm going to talk about the end. So if you notice that somebody is suffering from stage 4 cancer in your family, and you believe that they're making a poor choice, then you can try educating them, and you can always have them get a third opinion or a fourth opinion. A lot of our clients go to MD Anderson in Texas, or Mayo Clinic, or other tertiary centers where they get another opinion from the doctor, and that's always good. There's nothing wrong with that, because you want to see and compare what the standard of care is, and if you're not getting the standard of care, then you should try to look for another doctor. And so those are some of the examples of of the issues where you get into more side effects than the regular benefit of the medication. So how do we decrease the side effect ratio, or how do we get over the problem without causing significant harm to the body? And that is a difficult conversation that none of the doctors have, because they don't consider alternative treatments as part of standard of care. I get to have this conversation with my clients. We do functional medicine. Like sometimes if you have cancer, it may not be all related to genes. A lot of clients somehow believe that cancer is because of bad genes, like their mom or dad or their grandfather had cancer and their cancer is all because of them. Genetics has a role, but I personally don't believe that it causes more than 5% of the cancers. The rest of the 95% is because of what the client has done, or what's going on in their mind or what they have consumed. There are so many factors that can cause cancer. Like a gold standard example is if you're living near a nuclear dump site, you may not even know that there's a nuclear dump site in the ocean, and you may be living there for your entire life. There are a lot of these examples in layman's literature. There are places where there is chemical dumping going on, and you may be living there, and you may have noticed bone cancer, and you may notice bone cancer in your neighbors. You may notice a lot of cancers in your community. Unless you're able to connect the dots, you may not know it's because of the industrial pollution or dumping in the water sources in the community. There is also background radiation. We live in a world where there's Wi-Fi. This particular room is right next to the Wi-Fi router, so there's like Wi-Fi coming through. And if my body is sensitive to Wi-Fi, then it can theoretically cause cancer. I'm presently using a phone. The phone is constantly pinging the tower to communicate with the cellular tower. And if you have the phone right next to you all the time, which most of us have, I need the phone because of what I do with my job and whatnot. But some of us have the option of leaving the phone at the desk when we're home and not use it. But if you have the phone 95% of the time, the EMF coming through the phone can cause cancer. There is an issue with heavy metal toxicity. If you can have heavy metal toxicity just because of the water or air pollution or all types of things. And over time, as you grow older, the toxicity increases and the body is not able to catch up with it. Usually the liver and the kidney try to detox as much as they can, but sometimes even they don't have resources. Like a lot of people don't drink enough water, and if they're not drinking enough water, the body cannot detoxify. It cannot eliminate through the kidney. So sometimes the toxins get accumulated in the fat, or they get stored underneath the skin. And if those are if those are full, then this toxin keeps circulating in the bloodstream. So there are so many factors that lead to cancer. It's not just genetics. The problem is once they start on chemotherapy or radiation, then it starts killing the regular cells in the body. Most of the clients who have cancer, they have acid reflux because their body becomes more and more acidic. And once they have acid reflux, they get started on, we call it proton pump inhibitor, or in regular layman's terminology, we call them Prilosec or Pepcid or so forth. And once they get started on that medication, it suppresses the acid, and once the acid is gone from the stomach, so whatever bacteria we're eating, whether they're good or bad, they go through the food pipe, they go into the stomach, and now they're getting into the intestine, and they get to occupy the intestine and cause inflammation or colitis or all kinds of things in the intestine. And once you have inflammation in the gut, then the food absorption gets affected. Sometimes you may be absorbing the whole protein instead of the actual ingredients of a protein. You may be developing food allergies over time. And a lot of cancer patients, because they're losing weight, not only because of the cancer, but because of the treatment, like the radiation, the chemotherapy, the oncologists usually recommend them to eat whatever. And the reason why they do that is if they're really becoming picky and they're not eating healthy food, then at least if they're eating sugar, they're getting some amount of calories. That's the whole reason why they say that. But the problem is now they're drinking Ensure all the time, they're drinking Boost supplement, they're drinking all these sugar-based supplements, and the sugar is essentially another poison that they're consuming. And now the kidneys and liver are already under so much stress. Now they're like they start giving up. Now they can't process this sugar poison on top of every other poison that they have to deal with. So it can cause more inflammation in the gut. It can cause diarrhea. It can cause lethargy. A lot of cancer patients complain of lethargy. They don't want to get up. They don't want to do anything. They can't sleep at night time. Part of the reason is the medication, but part of the reason is all these other medications that are being administered to treat the side effects of the original chemotherapy. So if they complain about insomnia to the doctor, now the doctor prescribes them Ambien or Restoril or one of these sleeping pills. And the problem with the sleeping pills is once they get on the sleeping pills, now they get some sleep, they get some rest, but in the morning they wake up with grogginess. That's because of the side effect of the sleeping pill. We already know that the liver is under a lot of stress because it's having to deal with the toxicity of the chemotherapy and the sugar and whatnot. Now it has to process, the liver and kidney both have to process this sleeping pill thing. And they obviously don't do a good job of processing it. So the sleeping pill, instead of leaving their system in 4 hours or 8 hours, now it tends to linger even during the morning. So they don't feel like getting up and they're groggy. And once they're groggy in the morning, they tend to fall or they injure themselves or they start missing appointments for chemotherapy or doctor's appointment or whatever. And if they happen to be a younger person and they have a job, now they cannot perform in the job. So now they're on disability because they cannot work. Not only because of the grogginess from the sleeping pill, but also because of the side effects from the chemotherapy, radiation, and the cancer itself, causing them to become weak. Because the tumor cells are taking a lot of nutrients and resources from the normal functioning cells, and now the body cannot function like before. So I wanted to explain that in terms of it forms like a vicious cycle, and a 15-minute doctor visit that the cancer client has, they won't go over all these details, and they don't even have a chance of explaining and looking at what they can do to help. So that's a classical example of polypharmacy in somebody who's taking multiple medications. That's obviously like stage 4 cancer and whatnot. But even a regular client, so I'll go back to our client with the high blood pressure. So high blood pressure is very common, right? It's very, what should I say? It's very innocuous. It's not considered even a disease. I usually meet with new clients in the hospital and ask them, do they have any problems? They say they have no problems. Then the next question I ask them is what kind of medications you're on. And once they give me the list of medications, then I figure out the problems by looking back what the medication is for. A big misconception in that people have is once they're on lisinopril or atenolol or one of these blood pressure medications and the blood pressure is normal, they somehow believe in their own mind that they don't have blood pressure and they are completely cured of blood pressure, which is not true. They're being maintained on a medication. It's just like diabetes or high sugar. Just because you're on a medication to maintain your sugar level doesn't mean you're cured of diabetes. You're being maintained on it. It's the same as a person who has a cancer. They're on chemotherapy to maintain them. Most of the cancer studies give a 5-year treatment rate. So after 5 years, nobody knows if the cancer is going to come back or not. Even 15 years later, the cancer can come back. So these are all maintenance regimens. So just like HIV, we can control the CD4 count and we can give medication. We call them antiretroviral medications. We're maintaining them in a treatment state. We're not aiming for cure. It's not an actual cure. So most of the times, people get started on a blood pressure medication. They bring down the blood pressure. But here's the problem. The body has what is known as homeostasis. You have parasympathetic, you have sympathetic. So the common medication is, let's say this hand is sympathetic. So we try to bring this down by giving them medication that suppresses the sympathetic system. So the sympathetic system is here and it is coming down. So sympathetic levels are being suppressed. Now, what would be a normal response from the body? The body has what is known as homeostasis. It tries to correct it. So it tries to react and try to bring down the sympathetic hormones higher, like the adrenaline and so forth. It tries to counteract the blood pressure medication initially. And what happens in return? The patient goes back to the doctor in 2 weeks and the doctor increases the dose of medication or adds another medication. So then the sympathetic system is suppressed again. So after a while, they achieve a steady state where the body, cannot increase the sympathetic state, so the body just stays there. So the blood pressure is maintained. But that doesn't mean the blood pressure is cured. there is a reason why this particular client has blood pressure. As I discussed before, it can be related to high salt intake, or that's what most of doctors believe. But there are so many other factors that can cause high blood pressure. It can be because of excess stress over their lifetime. They may be going through a divorce. They may be losing a job here and there. There may be other emotional stressors. There is physical stress. If they're having to do 3 jobs instead of 1 job, they're having to drive here and there and do work. That can cause high blood pressure. There is an issue of heavy metal toxicity. They may be subjected to specific pollutants in the water and air and so forth that can cause their adrenal glands to react in a way where they are overactive and causing the high blood pressure. And sometimes it can be even emotional. There may be conflict between them and their colleagues at work. There may be conflict between them and their spouses at home. There may be conflict between them and their kids. So there are multiple emotional factors that can cause them to stay in a state of constant anger and anxiety, and that can cause high blood pressure. I routinely notice this where this particular client is on the same blood pressure medication for more than 10 years, and then they come into the emergency room because somebody passed away in their family and they're under extreme stress. So extreme stress can lead to a spike of blood pressure even though you're on blood pressure medication. So unless you're addressing the underlying root cause, there's no point in continuing to suppress the medication and keep going up on the dose of medications. The gold standard is once you go up to 4 medications, then usually as a general practitioner, I have to refer the client to a super specialist like a nephrologist and so forth to look at other hormonal causes and so forth. But why would clients need 2 medications, 3 medications, and 4 medications to control blood pressure? That means there's inherently something wrong in the overall management of that client. It's a similar situation with heart disease. I recently met with a client who had a bypass surgery to fix blockages in the arteries. And after that, the client had, I think, 2 more stents because he continued to have chest pain. And he keeps coming back for more and more chest pain in spite of all these procedures that happened over whatever number of years. So that particular client may have an issue with heavy metal toxicity where it is causing calcium accumulation in the arteries, and the calcium accumulation is the one that's causing the plaque formation. It's not the regular plaque formation from fat and whatnot. The fat does contribute to plaque formation, but there are other factors that are not being looked into in that particular client. So what we do in regular medicine for something like that, we give them more medication to treat the chest pain, we give them more nitroglycerin and so forth. So these are some of the issues with, let me just look at here. So these are some of the common examples that I see on a day-to-day basis where I see the problem where the root cause is not being addressed. And polypharmacy is not the treatment. Somehow in medicine, we're the doctors are treated that the more the problems, the more medications you give them. That is not the solution to the problem. The problem is to try to get them off of the medication, try to address their lifestyle. So if we go back to our simplest client, I'm not going to talk about the cancer and the heart disease and so forth. I'll talk about the simplest client. The simplest client is the one with the high blood pressure. So the one with the high blood pressure, if we look at him or her and try to address their diet to see what they're eating. It's not just salt. This is a very common misconception not only among doctors, nurses, but also among clients that they can reduce the salt and the blood pressure goes away. It doesn't go away. So I have numerous clients in my entire career that they barely eat any salt and they're on multiple blood pressure medications. So you look at why their blood pressure is high. Maybe they have inflammation in the gut. Maybe they're on a proton pump inhibitor or a Pepcid, like Prilosec or Pepcid, something that's suppressing the acid. And they usually get on those medications because they have a lot of acid reflux. And once they're on medication like that suppresses the acids, the bacteria that they're consuming goes directly into the gut and starts causing gut inflammation, causing diarrhea, causing lots of food sensitivities. So some of the clients, we just we don't do any testing. We just start them on an elimination diet. We remove gluten, dairy, and so forth for 2 weeks. See how their symptoms are. See what their activity level is. See how much alert they are during the day. See how their sleep is. See how their blood pressure is. Sometimes doing a simple elimination diet can relieve their symptoms significantly. Obviously, we try to heal the gut, and once the gut is healed, we try to reintroduce them over a period of time if we feel that the client is safe to take them. So by addressing the underlying cause, we can either completely have them stop the medication or try to cut down the dose where they're not having side effects. You can take low dose lisinopril, you can take low dose metoprolol and have minimal side effects. The common side effects with blood pressure medications are they make you sleepy because they are suppressing your adrenal system. They affect your sexual function. If you're a man, it can cause erectile dysfunction. If you're a woman, it can cause issues with the periods. They also cause issues with the adrenal axis and the way the cortisol is functioning. So over a period of time, you can develop depression. You can also develop increased body weight, like obesity. So by addressing the root cause, you're avoiding all these other problems. So the amount of time and money people invest in a doctor who does functional medicine will save them millions of dollars down the line. It'll have them an active lifestyle, even though people their age or once they reach 60, 70, 80, the other people are in a nursing home and they're not able to function because they're on like ton of medications. So our goal is to limit the number of medications and provide the clients with increased productivity and enhanced lifestyle. And for this, the client has to be involved and has to be a partner in the treatment. And unfortunately, in mainstream medicine, a lot of clients, they come to the hospital or they go to the clinic and they think that the doctor is going to fix everything. It's as if taking the car to a body shop. When I take my car to the body shop, I expect the mechanic or whomever to look at the problem and in 4 or 5 days to fix it and make the car look brand new and return to me as it is when I bought it. The body obviously doesn't work that way. So my philosophy, and a lot of doctors who do functional medicine and so forth, our philosophy is that the client has to be a partner in their treatment. They have to be the driver. They have to be involved 100%. And they have to be bought into their treatment. And unless they are bought in and unless they are completely involved in the treatment, no matter what I tell them or anybody else tell them, they may not follow through and they may not see the value in that. So those are some of the clients that we look for in our practice. A lot of doctors do heavy metal detox. So that's something I wanted to briefly talk about. So thank you all for listening, and I'm not ignoring you. So thank you, Heather, for the good comments. So if you have any questions, feel free to write them in the comments. So heavy metal detox is done through something like infrared sauna. There are a lot of infrared saunas in the Tampa area. I can give you, if you have any questions, just post in the comment and I can guide you to a place. In the future, we're planning to introduce infrared sauna in our practice. I'm going through the logistics. That's a really good technology where you go to the infrared sauna, spend 30 minutes, like maybe 3 times a week for a month or 2. And what happens is your body releases sweat, and through the sweat, it also releases a lot of heavy metals. That's an easy way to do heavy metal detox. There are other supplements. They are like binders you take orally. And the heavy metals are detoxed through the gut and they go through the bowel movement. Okay, there is heavy metal detox through IV infusion. A lot of doctors in the Tampa area who do EDTA and so forth. Yeah, thank you, Misty. I'll go ahead and share that in your group. Thanks for offering that. So the EDTA and DMSA and so forth can pull out the heavy metals from the body and try to eliminate them. That's slightly harsher. That's something I don't do myself, but a lot of doctors are offering that, and that's a good treatment. It's especially faster, but it also comes with side effects when you do that. So by reducing the pollutants, you're reducing the toxic load in the body, and that frees up the liver and the kidney to do what they do best. They start detoxing over time. What else? I wanted to talk about the water intake. So for a lot of my clients, I tell them to drink a lot of water in the first thing in the morning before they wake up, so that they get a head start. Because once we get started, we go to work. We either forget drinking water, or we try to skip, or we may not be comfortable drinking water from the tap, as it may be as simple as that. We may not have bottled water with us. So water is really important. Getting sunlight. For a lot of my clients, I tell them to get a lot of sunlight. If you're worried about tanning and skin color and whatnot, or skin cancer, you can do sunlight exposure early in the morning or late in the evening. Right now it's getting close to sunset over here. It's a beautiful time to just lay naked outside and get some sun. Obviously, if you don't have that, like I personally don't have that because of my work and whatnot, so you can take vitamin D orally. We're also exploring vitamin D injections, so we're trying to get products which are in depot state, where we give you one injection and it has a huge dose of vitamin D, and it would be good for at least 3 months. So I'm working on getting those products into my clinic. But even if you take over-the-counter vitamin D, like 5,000 units daily or 3,000 units daily, that sometimes brings up the vitamin D level to a healthy state within a few months. A lot of people even in Florida don't have sunlight exposure, and that's I didn't expect that when I moved here. I thought people would be spending more time in the sun, they'll be enjoy themselves, but even here people don't get sun. So heavy metal detox, getting sunlight, drinking a lot of water. So these are some of the treatments that we offer. So let me go back to the original example of anabolic steroid use. So what kind of, like if I see a kid with anabolic steroid use, or let's say even if I see a kid who doesn't have anabolic steroid use, but their testosterone levels are so low that they're always depressed, they have no libido, and they don't feel like doing anything, we try to look at underlying cause. We try to look at the sympathetic axis and the parasympathetic axis. Sometimes it's not balanced, it's out of whack. So if they're too anxious, and then maybe the sympathetic is overfunctioning, and if they're too lethargic, then the parasympathetic is overfunctioning. And there is a lot of technology that's available even in wearables now. Like I was talking to one of my friends this last month, and he showed me what is known as an Oura ring. So I looked at the display, and it is showing that the sleep cycle, how many hours they are sleeping. It also is showing what is known as heart rate variability. So a long time ago, like 8 years ago, when I started investigating heart rate variability, it was only available for doctors, and you had to pay 10 grand or whatever to buy the device, and then you can do testing. And at that time, we were offering that technology for each client. We would test heart rate variability, and we charge them like $100 or $200 per testing. But now that's, when it's included in the Apple device, in the Fitbit, now it's getting included in all these devices. We probably don't need to offer that anymore. I'm still debating. But if you look at heart rate variability, if you have a wearable device and you can measure heart rate variability, it will give you key information on what is known as PAR. If you have really good PAR in the sympathetic system, then your system is resilient enough to handle stress. Now, if the PAR is too low, if the heart rate variability is messed up, then chances are you need some work on the adrenals. So your body is not in a position to cope with emotional stress or physical stress or any type of stress. And apparently, a lot of athletes, they are using heart rate variability with wearable technology now. So, start exploring that. A lot of you people who are listening, you probably have wearables, and just look through the app if it offers heart rate variability. And also you can comment below with your numbers. If you don't know how to interpret them, I can guide you through that. So by using heart rate variability in these kids, we can figure out what their power is, and based on their power we can work on their adrenal glands, try to give them adrenal support, try to have them do some detox if they have a lot of toxin load, and that easily fixes their problem. You really don't have to go to like testosterone injections and so forth. I have clients, like older clients, who are getting testosterone injections and so forth, but the younger ones, they most of the times they have good reserves in their body that can kick in and fix the problem and try to and heal it. The body has innate healing ability. This sounds like a alien concept to a lot of people, but once you take out the stressor, the body can quickly heal itself and get back to a normal functioning. So that's about the anabolic steroid use. The next topic that I talked about is dermatology and increased use of cortisone creams and so forth. Obviously there is a role, but if you're using these creams, even the immunomodulators, I talked about pimecrolimus and those creams to suppress the rash or whatever, inflammation in the skin, then you really need to look at the underlying cause. The underlying cause can be as simple as gluten sensitivity or sensitivity to lactose. So maybe a simple elimination diet can help. So for that, we offer technology in our clinic where we can figure out food sensitivities, and based on the testing, we recommend clients to go through an elimination diet for 2 weeks or 3 weeks, and then most of the times their symptoms improve. And as I said before, we can reintroduce those foods, or we can bring them in later when the client feels comfortable, once their gut is healed, to see if they can handle them. Hey Tiffany, thanks for that question, SIBO. I'll address it at the end once I'm done. So those are some of the examples of how we look at the root cause and try to get them off of the medications, or try to at least get them on a reduced dose of medications. I strongly believe in using medications. Like all of my asthma patients, I have them carry a rescue inhaler. They may not need an inhaler all the time, but they should have a rescue inhaler as well with them. So medications have a role, but when you're using them for long term, there are significant side effects that you have to be aware of. So as a doctor, it's my job to educate. So I'm going to do more of these lectures going forward in the future. If you want an in-person lecture, feel free to come to our center. We offer those every month or so. We're planning to do more of those. Sometimes in person is much better. You can have one-on-one conversations with me. So these are some of the strategies that I use with my clients. And there are numerous other examples that I can go over on how to deal with polypharmacy. This is part of my job in the hospital as well, working with the clinical pharmacists, looking at medications, and so forth. And also in your personal life, you should use the pharmacist as a resource. A lot of clients, they want to go to the doctor and they want to have the doctor do everything, but unfortunately because of time constraints, or the doctor may not even be trained in looking at all these drug interactions, they are not the right person to talk to. So if you know of a good pharmacist that you are working with in your pharmacy, you should make sure that you're in constant touch with them and ask them as many questions as possible, and try to read the package insert. Most of the people get a package when they get the medication, but they rarely read the package insert. That has so much good information, that has all the black box warnings. That is sometimes life-saving. So that is something I would advise you to do on a regular basis. So I'm going to briefly answer questions. So Tiffany, thanks for posting about SIBO or dysbiosis. So please post your questions in the comments if you want me to talk about something. So SIBO is actually SIBO. It's called small intestinal bacterial overgrowth. So it essentially means that instead of having friendly bacteria in the gut and in the gut lining, we have these bad bacteria or pathogenic bacteria. These are the bad guys. These are not supposed to be there. Something like E. coli, something like what should I say, Clostridium difficile, something like a parasite, like a hookworm, or so when there's bacterial overgrowth, what happens is you may be having a lot of bloating, you may be having diarrhea on a regular basis, you may be having food sensitivity, you may be having fogginess in the brain, because the gut and brain is connected. Again, this has been established by research recently. This is not a misnomer anymore. Like 80 years ago, when I talked to other doctors, they look at me like I'm like an alien. But now there is an established gut-brain axis. So anything that's going in the gut is going to affect the brain. So if you have SIBO, or small intestinal bacterial overgrowth, it can cause sluggishness in the mind. If you're sitting in front of the computer and you're working, after 1 hour you want to just stop working and lay down and sleep. Happens with me also. You get tired easily. You can't complete the task at hand. You can't focus. You can't concentrate. You feel sleepy during the day. You feel sleepy while you're driving. At night time you can't fall asleep because something is rumbling in the abdomen. So these are some of the symptoms of SIBO. The second one is dysbiosis. Dysbiosis is an imbalance in the gut bacteria. So what we're looking for in the gut is a predominance of the friendly bacteria and maybe some bad bacteria if they're there. When there's an imbalance, if there's a higher amount of bad bacteria compared to good bacteria, that is dysbiosis. Now the SIBO, where small intestinal bacterial overgrowth, the bad bacteria are too much. They're like taking over the entire gut. That's a severe stage of dysbiosis. And the standard treatment is, we get labs, we check the stool for bacteria, try to see which bacteria they have, and then and based on that, we try to give them a cleansing protocol, whether it is juicing or supplements or combination thereof, so forth. Also sometimes elimination diet. And sometimes we may even give antibiotics. Sometimes we have to give medical grade antibiotics if they have small intestinal bacterial overgrowth. And once we give the antibiotic, we try to rebuild the gut by giving friendly bacteria using probiotics. So a lot of clients, what they do is they read online and they may have these symptoms and they may have this diagnosis, and they start using probiotics. If you take probiotics while you have this problem, it may or may not fix the problem. It may alleviate slightly. But if you go through the whole treatment exercise, then you're cleansing the bad bacteria first and then rebuilding the gut from the inside. Some docs use colostrum, we offer that as well. So by rebuilding the gut, then you're establishing the good bacteria and making sure that the bad bacteria cannot come back in. So that usually takes anywhere from 3 to 6 months, depending on how bad the condition is. So that's what we offer for treatment. Tiffany, does it answer your question, Tiffany? Already. I don't know if Tiffany is still there. So anyone else have questions? Let me look through the comments here. Misty, do you have any questions if you're still there? Heather, Carrie, and Karen Klein. Thanks for joining, Karen Klein. Geraldine is there. Hannah is there. Yeah, any other questions that you guys have? Feel free to post them in the comments below. I'll wait for you. Thanks for listening to this lecture on Labor Day. I know this is a holiday across the states. If you're in Florida, don't watch the news, as I said before. So it just causes more anxiety. So we offer a lot of treatments in our clinic. I'm just going to talk generally about what we offer in the clinic. I also do energy healing. A lot of my clients, may or may not be inclined to go through the functional medicine treatment. And sometimes they need extra support beyond functional medicine treatment. They need work on mindset. They need work on habits. If somebody is eating donuts every day in the morning and you ask them to quit eating sugar one fine day, it's not going to happen. So you have to really work on their subconscious mind and try to remove that addiction to sugar. And the best way to do that is to use energy modalities that I offer in the clinic. We offer a lot of other treatments. If you're interested, we offer stem cell treatments for people with arthritis and a lot of other conditions. We are exploring mistletoe. We're exploring a lot of these other holistic treatments. So again, thanks for joining and listening in today. And feel free to comment below. Feel free to share this with your friends. I hope you got some value from this. I look forward to talking to you again. Feel free to call me at my office number 813-337-7535. And go to my website. Follow me on the social media. Invite your friends to join here. Obviously, these are for free, and this is a way for me to bring awareness about issues. So there are a lot of fantastic things that are available. If you're suffering from an illness or problem, it's not the end of the road. You don't have to rely on a medication for the rest of your life. Again, have a happy holiday. I hope you're all enjoying yourself. I look forward to talking to you again. Thank you.